Welcome to the Community Health Hero Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be talking with Bridget Gladys, who will offer 5 tips for purchasing health insurance on the Louisiana Health Exchange. Suzanne Whitaker, who will tell us about the American Heart Association's Go Red for Women Luncheon. And Dr. Jason Parker, a pediatric dentist who will talk about caring for your child's teeth. And Chef Trey of the Green Fork, the only restaurant in the city serving Eat Fit Nola King Cake. So don't go away, we'll be right back with more Community Health Heroes.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
And welcome back to more Community Health Heroes. Do you know the difference between copay and coinsurance? Don't worry, most people don't. With open enrollment for the Federal Health Exchange underway, thousands of Louisianans are shopping for individual and family health insurance coverage for 2015. Join us today to offer tips to help people select the best coverage options and to make the application process a little easier is Bridget Gladys, Public Exchange Director of United Healthcare Gulf States Region. Bridget, thank you so much for taking the time to be on the show today.
Well, thank you for having me. I'm glad to be here.
So everybody's kind of concerned about getting their insurance this year. Can you tell me, when does the open enrollment actually completely end?
Well, we've got until February 15th, so we're right in the middle of things right now, but everyone will have until February 15th to get enrolled through the marketplace.
And then that's it?
That's it, unless you have a special event, you get married, you lose coverage through your employer, you age out of your parents' plan. So other than special enrollments, that's it.
Wow. And then you had some tips you're going to share with us.
I did. It's different this year. It's a little bit easier than it was last year to get enrolled through the marketplace, but we do want people to kind of be prepared and know what they're going into. So the first thing is to be prepared and understand all the terms associated with health insurance. So do you know what a copay is? Do you know what coinsurance is? And United Healthcare has tried to make it a little easier. If you go to justplainclear.com, we've put together a glossary in both English and Spanish to help people get prepared for going to the marketplace and buying coverage.
Because those terms can be really confusing.
Absolutely, and they're very key to understanding the total cost of your health insurance. So once you kind of understand what's going on, then we want people to take a step back and understand it does take around an hour to an hour and a half to go through the process. It's a little simpler this year, but it still takes a little bit of time.
So be aware that you need about an hour to sit down in front of your computer or the library's computer to go ahead and answer those questions. Okay?
Absolutely, and that's if you have all your information together. So you want to make sure you've got social security numbers for all of the people in your family. You want to make sure that you've got wage information, so either your tax return or your W-2s from all earners in the household. You want to make sure that you understand what your employer offers in terms of health insurance and your spouse's employer offers, because that's going to impact
Wow.
whether you can get a subsidy or not. So if you've kind of got all those things in order, then you're ready to sit down and begin the process. So if you go on to uhc.com/join, you can see all the offerings that United Healthcare has available. And you can pick your plan. So you'll see your premium, you'll see the co-insurances and the deductibles and that sort of thing, which contribute to the overall cost of your coverage. And you can look at where you want to be. So it'll calculate your subsidy for you that you get from the federal government, and it'll also give you all the information about network design, what kind of pharmacy, your
Benefits.
prescriptions that you are covered, and it'll help you understand, is your doctor available, is the hospital that you normally go to in the network, and you can kind of evaluate all the plan designs. And once that's done, then you pick where you want to be and go through the process. You answer about 10 questions, and you're set up and ready to go.
And when's the first payments due?
The first payment is due before your coverage goes into effect. So if you enroll by February 15th, you will have a coverage beginning March 1st. So your payment is due before your coverage goes into effect, but we are allowing people to pay all the way through March for that March 1st effective date.
Okay. So people are really worried about paying penalties. Is there a way to avoid paying a penalty?
You absolutely have to have coverage in 2015 to avoid paying a penalty. You can't go more than 90 days without health insurance coverage, or you will pay the penalty, which for 2015 is $325 per adult in the household, $162.50 per child, or the kicker is, or 2% of your income.
Oh, wow.
So it really can, get pretty costly there. And if you go online and you go through the marketplace, a lot of times you can get coverage for fairly inexpensive, and in a lot of cases for less than what the overall penalty would be.
So like if you have like a 19-year-old living in your home and they could potentially be on your insurance and you didn't get it, that would also be a penalty?
Yes.
Okay, well that's really good information. So if our viewing public would like to know, where do we go to, if we have questions, or how do we go to enroll, where would we go?
So you can go to United Healthcare's website at uhc.com/join. You can go to healthcare.gov, which gives you, everything that's available in the marketplace. Or if you feel like you need further assistance and you want someone to walk you through the process, we have dedicated agents that are available, till 9 p.m. Central Time, and you can dial 1-844-JOIN-UHC, so JOIN-UHC, and we've got folks available to walk you through the process and get you enrolled.
Well, I mean, you just brought a wealth of information to us today, and I really appreciate it, because I know a lot of people have questions about this whole insurance thing.
Absolutely, and I know it's complicated, and it seems like it gets a little more complicated each year, but we really are doing our best to simplify things and help people get covered.
Well, thanks for taking the time to be on the show today, Bridget.
Thank you.
When we return, we'll be speaking with Suzanne Whitaker about the American Heart Association's Go Red for Women luncheon on February 6th. So don't go away. We'll be right back with more Community Health Heroes.
So this is my computer.
This is your computer. Let's go on the internet.
Let's go. Click it.
Yes.
Okay.
I cursor in between the R and the E. When I say dot, I want you to just push the period.
She's gonna love me all over again now.
That's it. Jamaica, here you come.
Here we go.
Good job.
Thank you. Thank you. And I did it by myself. Feel smarter.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Welcome back to Community Health Heroes. Did you know that 1 in 3 women have some form of cardiovascular disease, and that it kills more than 420,000 women every year, which is about 1 every minute? Joining us today to talk about what you can do to protect the women in your life and the upcoming Go Red for Women luncheon on February 6th is Suzanne Whitaker, the 2016 chair of Go Red for Women. Hey, thank you so much for being on the show today. We're talking about heart disease in women. Can you tell me if heart disease is preventable?
Heart disease actually can be prevented by lifestyle choices, diet, and exercise, although if you have a family history of it, it may not be preventable, but you can certainly take steps to mitigate it.
Well, what should women do differently than what men should do?
Well, women need to understand that heart disease is the #1 killer, more so than all cancers combined. And what they need to do is keep an eye on signs and symptoms. Sometimes it can even be silent. They should go get regular blood tests done, check their cholesterol, and also be aware of any unusual aches or pains that they might have.
So at least see your doctor once a year?
Yes, absolutely.
Well, you were just mentioning that cancer is such a big concern for women, but heart disease is the #1 killer. Why do you think people are so concerned about cancer versus heart disease?
Well, I think cancers have enjoyed a large-scale educational campaign, especially for the female cancers. And that's exactly why Go Red was born, in order to launch an education initiative for women to let them know that heart disease actually kills more women than all cancers combined.
And then you have this great event coming up on February 6th. Can you tell me about that?
Sure, would love to. Actually, it's on Friday, February 6th, and it is National Go Red Day, so everybody should wear red to support the event and the cause, but also at the actual event, we're going to have silent auction, speakers, and a wonderful luncheon, and a fashion strut show as well.
So that helps make the community aware the heart disease is very important with women. What else does the February 6th do?
February 6th, as you said, brings heightened awareness to women and heart disease. It's also our vehicle to get educational information out on signs and symptoms and things that women can do to help prevent heart disease.
And you have some absolutely fabulous speakers that come.
We do. We have women that are heart disease survivors that come and tell their story and how they discovered that they had heart disease and what they did to help address it.
So if our public wanted to know more, how would you find information about your program?
You would go to our website at neworleansheartgored.org.
Okay, neworleansheart.red.org?
.org.
Okay, is there any other way to find it, or telephone number or anything else?
All that information will be listed on the website.
Well, that is just fabulous information. I know women sometimes don't take care of themselves. They're so busy taking care of other people that a lot of times they'll skip the signs and symptoms of heart disease. So I really appreciate you being on the show today.
Absolutely. Pleasure to be here.
All right. When we come back, we'll be speaking with pediatric dentist Dr. Jason Parker about your child's dental health. So don't go away. There's more to come on Community Health Heroes.
This song was created with heartbeats of children in need. Find out how it can help frontline health workers bring hope to millions of children at everybeatmatters.org.
When you have a hole in your neck, don't face the shower head.
Suction out your tube before you eat. Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home.
Okay.
Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Okay.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you.
Let's go.
Search We Can for more ideas on how you and your kids can get healthy together.
Welcome back. Did you know that children should have their first dental visit by their first year, and that teeth begin growing even when the baby's in the womb? Joining us today in recognition of Children's Dental Health Month is pediatric dentist Dr. Jason Parker. Welcome to the show, Dr. Parker.
Thank you. Thank you for having me here.
So you're a pediatric dentist, and our audience has lots of questions. So when should you first take your child to the dentist?
Our guidelines have changed over the years because what we're trying to do with children is prevent cavities from happening at all. So to answer that really quickly, the American Academy of Pediatric Dentistry, that's our governing body for pediatric dentists, with the use of research and different aides, have recommended age 1.
So by the time they're 1 year old, you should get in to see your
and
dentist.
the biggest thing is getting the children off the bottle by then, stopping the breastfeeding, brushing the teeth as they're coming in, and getting that child in to assess any problems that may be occurring that early.
Well, you bring up a good point. When should you start brushing your child's teeth?
Well, the parents should be doing the brushing really on up into the early teens, like the child's 10, 11 years old, because that hygiene kind of dips around those teens, the hormones go up, and children sometimes will get in there and do it really fast, okay, and they say, yes, we brush. So I think it's okay to give them a sense of independence to brush their teeth, but the parents still should be coming behind to check and make sure we're getting around the gums, on the chewing surfaces. And the other thing that cannot be missed that's just as important as brushing is flossing.
Okay.
Because a lot of parents are watching the sugar intake that children are consuming. They're doing a good job of brushing. The children are doing a good job of brushing. Parents are following up. They forget to floss, and a lot of cavities can happen in between the teeth.
Oh, that's a good point.
Yeah. So that's the flossing is just as important as the brushing is.
Okay.
Yeah.
So kind of changing gears, when should you first have your child evaluated for orthodontics or braces?
American Association of Orthodontics recommend around the age of 8. But there are certain conditions when say, a child's overbite, where the top jaw, as it relates to the bottom jaw, is reversed, and so the bottom jaw sticks out further than the upper jaw. That needs to be looked at a little earlier, okay? Certain cross bites where the upper arch is not fitting correctly with the lower arch. So usually when the pediatric dentist sees them first, assess the condition that's going on, if there's a severity of crowding, there's cross bites, whether it be in the back or in the front, getting that child in to see the orthodontist in a timely manner, maybe before age 8, maybe around age 8, maybe a situation where the crowding is not as severe, where the braces will, you'll see that child every 6 months to a year until the braces are ready to go on. So it's kind of like, that's not a hard and fast rule, but that's the guidelines as far as getting them in by age 8.
And so how often should you take your child in to see a dentist?
Every 6 months. We generally, if we have a child that has poor oral hygiene, they're not brushing, they could do a little bit better, we'll maybe see them maybe once a month or every 3 months. Going back to orthodontics, if the child is in braces, they're not doing a good job, we don't want to let them go for 6 months and have that hygiene just go south on us. So we may get them back on a monthly basis to clean them until they show us that they can give us some really good hygiene habits.
So I think you had wanted to talk about mouth guards.
Yeah, it's another part of children's dentistry that not necessarily gets overlooked, but it doesn't get emphasized enough. But if children are playing sports, wearing a mouth guard, whether it be boxing, karate, football, baseball, basketball, a lot of elbow to the mouth, knee to the chin. There's so many things that can happen in contact sports, but if we're not wearing that mouth guard, the incidence of injury can go up substantially.
So it really helps prevent what?
Yeah, and there are so many different kinds. There's regular mouth guards that we can buy at the sporting goods store. The problem with those, they're cheap, but they don't fit very well. Okay, they serve as a cushion for any kind of blows, but we can also make a custom mouth guards that'll fit that child specifically for a season of play.
Great.
Yeah.
And if I want to find out more information on pediatric dental care, where would I go?
Well, you can go to the American Academy of Pediatric Dentistry, which is aapd.org, or you can go to my website, which is docparkerforkids.com.
Oh, cool.
Yeah.
Thank you so much for being on the show today.
Yes, thank you very much. I really appreciate that.
When we return, we'll be in the kitchen with Chef Trey of the Green Fork, who will show us how to make the city's only Eat Fit NOLA version of the king cake. So don't go away, we'll be right back with more Community Health Heroes.
Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities. To ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child.
Give.
Advocate.
Volunteer. Live united. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Molly Kimball, a registered dietitian with Ashner's Elmwood Fitness Center, has collaborated with nearly 50 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items available on restaurants' menus, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Joining us for today's Eat Fit NOLA cooking segment is Chef Trey Berger of the Green Fork, who's going to show us how to enjoy everyone's favorite king cake, but the Eat Fit NOLA way. Thanks so much for joining us today, Trey.
Thank you for having us.
So tell me, how do you make a healthy Eat Fit NOLA king cake?
It's pretty simple. The ingredients are eggs, coconut flour, coconut oil, coconut milk, and a little bit of maple syrup. We use pureed bananas as the main sweetener, and we add to one version chocolate chips, or one version we add blueberry and lemon.
Oh wow, so you have two different versions of the Eat Fit NOLA king cake on your menu.
Yes.
Awesome. So tell me, how do you make an Eat Fit NOLA king cake?
Sure. The base of the cake is 6 eggs, 3 pureed bananas, 1/4 cup of coconut flour, 1/4 cup of coconut oil, 4 ounces of coconut milk, a teaspoon of vanilla, and then sprinkled with coconut sugar in between each of the scoops that we put in the pan before we bake it.
Well, why don't you show me how you have your blueberry lemon one?
So this is the blueberry lemon one prepared, and we use a regular size ice cream scoop. In each of the pan, we use an Angel Food pan, which gives you the nice round shape with the hole in the middle. And you do 5 scoops. And so I'm going to start with just 2 of them here. And then on top, in between each one of those scoops, we're going to sprinkle just a little bit of coconut sugar. And you can also add more cinnamon to this if you want. That doesn't add any calories, but adds a nice little flavor to it. And then you fill in with the other scoops in between those. The key is not to add too much of that coconut sugar to add a lot of empty calories in the king cake.
And so in this king cake, how many servings?
16 servings in that king cake, and each serving is 120 calories.
Wow.
So way lower than your traditional king cake.
Kidding. And are these ingredients pretty common in this area?
They are. You know, I understand that Walmart is carrying a lot of the natural sweeteners these days. Maple syrup is pretty easy to find. Coconut milk sometimes is only in the Asian aisle of the grocery store, but very accessible.
And most stores will have most of these ingredients then.
That's correct.
Awesome.
And then this bakes at 350 for about 25 to 35 minutes. Every oven is a little bit different, so you just want to watch it. It's kind of like a banana bread, so a little more dense than most king cakes, but definitely still delicious and sweet.
Now, how did you get this really amazing looking frosting and sugar?
The frosting.
That's not sugar.
That's not sugar, correct. The frosting is made, again, with coconut oil, creamed coconut, coconut milk, and a little bit of stevia. And you just mix those things together. Now, coconut oil and creamed coconut can kind of be in a solid form at room temperature, so you may have to dunk them in a little bit of warm water to get them to loosen up a little bit.
Spread out a little bit.
Yeah, and then once you get them all mixed up, if it's still runny, put it in the refrigerator for a few minutes and it'll come to a thick consistency, kind of like that.
And then we have some really cool
colored sprinkles that are not sugar, correct. And then when you want to ice it, after it comes out of the oven,
so do you let it cool before?
Let it cool, yes.
Okay.
I would let it cool out at room temperature for about an hour. With it being a dense kind of a cake, you definitely want all of the heat out of it. If you put the icing on before it's completely cool, it's not disastrous. It really just becomes more like a glaze, so it doesn't necessarily stick to the top of the cake the way it does in the finished one over there.
So we're using a baby ice cream scoop for this?
Yes, smaller ice cream scoop there. And then you're just gonna kind of spread the icing around.
Oh, it smells so good.
Yeah, very coconutty, right?
So Trey, Louisiana ranks 45 out of 50 states in obesity, according to the America's Health Rankings this year. Is it hard to make a Eat Fit NOLA recipe, a dessert recipe?
I think you can take any of your favorite recipes and do some internet research and look for healthier ingredients, less sugar, ways to sweeten with stevia or more natural rather than refined sweeteners. And it's not always easy, but I think with some practice you can take just about any recipe that you love or your family loves and turn it healthier.
That's a great answer. And so how do you put on these little sprinkles? And they're actually edible yellow glitter.
Right.
And they actually are really shiny looking, and they do look like sugar.
They're sugar-free.
And if I want to know more about your Green Fork, where are your locations at?
We have a location in the Lower Garden District at 1400 Britannia on the corner of Thalia, and also a store on Metairie Road at Friedrichs, 200 Metairie Road. Both stores are open Monday through Thursday from 7 in the morning until 6 in the evening, and then on Friday and Saturdays from 7 until 4.
And could you call in and order king cake?
Absolutely. They sell out pretty much every day, so
Wow.
it is best to order ahead.
Okay.
We do bake them every day for each store, so you can walk in and we sell it by the slice or by the whole cake.
Oh,
so
wow.
if you just wanted to come in and try it, we have it there for you to try before you commit to buy the whole thing. But we do sell out every day.
Oh my gosh. So it must be an incredibly delicious product.
It is. It's great.
And I had one last question. You have some other things on the menu, but you were saying that it changes weekly that are Eat Fit NOLA friendly.
That's correct. Yeah, we have, that's kind of what we do. We do healthy food, and we've taken a lot of the food that we grew up with as Southerners and good Southern boys and made them more healthy. Like we do chicken and dumplings, and we do them with whole wheat dumplings, and we're doing them with gluten-free dumplings rather than the regular fat-laden, heavy milk and cream chicken and dumplings. So we have several things that are Eat Fit NOLA approved, and they kind of rotate in and out of our menu at the stores.
And also you have some other items that you were telling me that you have some vegan items on your menu.
Right, we do lots of vegan and gluten-free. We do a little bit of meat as well, but our focus really is definitely gluten-free, everything on the healthy side, and lots of vegan as well.
Thank you so much for joining us on the show today and sharing this delicious recipe with us. Join us next time for another Eat Fit NOLA cooking segment when we feature another fantastic local restaurant offering nutritious and delicious dining options. We'll be right back with more Community Health Heroes.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on line.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
She took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
Packers, Vikings,
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our new website at www.communityhealthheroes.org. We hope that the information provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.